All right, how's it going, guys? So today I want to be talking about Term 4 at SGU and what I think is the best strategy in order to score in the 90s or to honor Term 4. So in order to understand what they're going to be asking you in Term 4, you have to know what you learned in Term 1 and Term 2. In order to simplify Term 1 and Term 2, you're learning about the norm. You're learning about how the body normally functions, the physiology, the anatomy. But now in Term 4, you're going to be taking it up a level. You're going to be learning about all the different pathologies associated with the systems. You're also going to be learning about some of the causes that are microbes, so the viruses, the bacteria, the fungi, and then finally how to treat these. So I would say these three, it's always good to keep in your mind: the pathology, the micro, and the pharm, because this is what Term 4, I would say the pillars of Term 4 are these. Now, Term 4 also comes with a lot of small groups and a lot of clinical skills, the SOAP note writing, interviewing patients, and taking physicals. I don't want to talk about that right now, but I'll make a different video about that. But I want to make a video about specifically what you're going to be learning about in Term 4 when it comes to lectures and when it comes to exams, because a big portion of your final grade comes from these lecture exams, and I would say that's the most important thing to focus on. Now, Term 4, we have 4 modules: FTCM, CRS, RHS, and DERS or DERS. Now, FTCM is the first one, and this is by far, I would say, right now I've finished all the 5 terms of basic sciences at SGU, and FTCM is the most important by far of any module that you're going to be learning. The reason is because the FTCM, I don't know the exact acronym, but I think it's Foundations to Clinical Medicine. And the foundations part is very important. You're going to be learning a lot of the things that is going to set the pace for everything else that you're going to learn throughout the term, and everything else that you're going to learn Term 5, everything that you're going to review for your big exams, CBSC and STEP. And this is why FTCM, but Term 4 as a whole, is important, because it's the foundations to everything that you're going to be learning when it comes to preparing for these big exams, such as CBSC, Step 1, Step 2. And also your clinical training as well. So back to this. So we have FTCM, we have our CRS, RHS, and DERS. Now, starting from the get-go, from the beginning, from day one, you have to have a strategy. You can't go in with the same strategy that you had in Term 1 and Term 2. It may work for you, but for a lot of students, everybody can agree that Term 4 is a different term all in all compared to anything before. So the best strategy that I would say is to keep these fundamentals in mind. What does that mean? Is that you're going to be given lots of content in lecture, and you can use that time to obviously try to pay attention. But personally, I would say that it's better to learn from outside resources compared to the lectures. Lectures are sometimes hit or miss, but outside resources, they are proven to work. Specifically, we can go through them. Number 1, pathology. Is you're going to be using Pathoma. Pathoma is the gold standard when it comes to pathology, and what you can do is pretty much go through Pathoma for the different modules, and there's specific chapters on Pathoma that are correlated with specific modules at SGU, and you should be going through these specific chapters for each module. Okay, FTCM. It's going to be your chapter 1, 2, and 3. You should know chapter 1, 2, and 3 from front to back, even if it's not associated with SGU word for word. You should definitely have chapter 1, 2, and 3 down to a T before you take FTCM. Okay, CRS, it's your cardio and your renal, so it's going to be chapter 7, 8, and 12. Your vascular, cardiac, and kidney and urinary tract path. For RHS, make sure you do 4, 5, and 6. That's your heme and your white blood cells and your leukemias and lymphomas, and also your respiratory tract. Then finally, DERS. DERS is a big one. You have your GI, your endocrine, and your male and female repro, and also your breast pathology. The rest are going to be in Term 5. Okay, so this is a little thing you can take a look as well, but this is kind of a guidance for what you should be doing when it comes to Pathoma. Watching the videos and learning. You don't have to be learning from SGU, but you have to spend your time on Pathoma learning. It's not just a pass, just to go through it. It's not a review. He explains it really well. So this is the best time to learn. Okay? Now, that's for your path. For micro and farm, they're going to be teaching to you in slides as well. But I really want you to watch Sketchy videos. Sketchy is excellent for retaining, and it'll pay dividends on exam day if you watch the videos. Specifically, we have our Sketchy micro videos and our Sketchy farm videos. Okay, so this is the basic rundown of what you should be doing when it comes to learning these topics. And okay, now let's talk about this. You go until your lecture, your first lecture in FTCM, and it's a lot of content. Now you're like, okay, what do I do? So this is what you're going to do. First, when you rewatch the lecture, your main question in your head is this: what does SGU want me to know? That's what the lectures should be answering, okay? Not exactly what the specific topic is that will help me succeed, but exactly what does SGU want me to know? Not anybody else, not the NBMEs, nobody else other than SGU, because that's what the exams are going to be on. Next, you should be finding the resource. This is the outside resource. Outside resources are key. Your Pathoma and your Sketchy specifically, those are the ones that you should be looking for. Then you're going to be obviously watching those videos, learning from those videos, taking notes on those videos, and learning. Finally, you've done your learning, you did your path and you did your Sketchy for that specific lecture. And now, going back to point 2, a lot of it is searching. Learning and searching. Searching means you are finding that specific chapter and that subchapter for, let's say, FTCM when they're learning about apoptosis and necrosis, and you find that specific part in that chapter and then you read it, or you listen to the videos on it and you take notes on it. That's the searching process. It's matching your outside resources to the SGU content. That's the second step. Then the third step is review. Reviewing is key. You have to get these passes down, and you're going to be learning lots of content, tons of content, and you're going to have to be able to retain it and get tested on it and apply it within 3 to 4 weeks. That's how long each module usually is. So the best way to review this, I would say this is the most important part of the video, is AnKing. AnKing is the best for term 4. A lot of students, they start using AnKing, and I think term 4 is the best time to, if you haven't started yet, to start incorporating AnKing into your studying. Specifically AnKing, why? Because there are tags for your path and tags for your Sketchy. So that makes it so easy. Once I'm done watching a chapter of Pathoma, I can go onto AnKing and I can unlock cards associated with that chapter and review those constantly over and over again. And in that way, I'm getting my reviews done. I'm also preparing for SGU. You're gonna do, if you do this, you're gonna do great on these exams. But that's not the entire point. We all know that the point of doing good on these exams is in order to do great on your CBSC and your STEP exams. So you are planting the seed by doing these steps and doing your path, doing your Sketchy. You're going to be planting the seeds in order to succeed on these big exams. And you're kind of hitting 2 birds with 1 stone, because you're doing your SGU material, but you're also getting prepared for your CBSC and STEP by using AnKing, by using these resources. So keep that in mind when it comes to term 4, because it's a tough term. There's a lot of content, but make sure you're going through these questions in lecture. You don't necessarily have to focus on everything the lecturer is saying, but you should be asking yourself, okay, what is the thing that SG wants me to know from this lecture? Now you can ask that. Then once you know it, you find the resources, and I kind of gave you guys a little bit of a leadway to find those resources. We have Pathoma, we have Sketchy. For Pathoma, these are the chapters for each section that you should be knowing. And then for Sketchy, pretty much going through, if they talk about, let's say, a specific microbe, find that microbe, find that video, and learn everything that you can about that microbe. Even if it's not associated with SGU specifically, you can learn it because you're going to have to learn it eventually. And same with the farm videos. If they're teaching you guys about, let's say, sympathetic drugs and FTCM, it's a review from FTM, but they're going to go more in depth. So that's when you can use the farm to really review, get those old term 1 and term 2 topics down, and then build up on them. Because you're going to be learning a lot of new content and also solidifying the old content. So that's what you're going to be doing for your Pathoma and your Sketchy. And then finally, reviewing them with AnKing. Just keep doing those reviews. You're going to get a lot of reviews, especially in FTCM, because there's a lot of cards. There's lots of content and a lot of little details that you should know. You're going to be doing over 500 cards every day. But I'm telling you, it's worth it. Once you get to the point where you have to take the exam, you are going to be in a great spot compared to the rest of the students. You're going to know the first day lecture like the back of your hand, while a lot of students are going to be forgetting it. They're going to have to re-review, but you're going to be in a great spot. And you're going to do great, and you're going to kill it. And you're going to see that it's worth it. And you're going to set the foundation for the rest of your medical career in term 4. So take it very seriously. Try your best. And if you guys have any questions, please let me know. Thank you. Bye.